health center here in Harlingen that we all call the RAC decided that on National Doctors Day they would send faculty members to different schools to talk about what it is to be a doctor. And so we were very fortunate this morning that Dr. Nolan, Perez, a gastroenterologist, I always get messed up on that, gastroenterologist, I
That's
get
good.
right?
That's good.
Yeah. I need a round of applause for that. Here in Harlingen, chose to come to Dr. Cano Freshman Academy. Dr. Perez is also one of our members on our school board here in Harlingen. And he has a lot of information to give you about a medical career, and then at the end he will entertain questions. So let's give a big warm welcome to Dr. Nolan.
Well, I'm going to see if I can take this mic off so I don't have to stand exactly in one place, although I'm going to probably drive him crazy with the camera, but that's okay. I get it. So I want to thank you all for allowing me to be here today. And, this National Doctors Day, I think is very important, especially with the opportunities that we have before us now in the Rio Grande Valley. How many of y'all have heard that we have a new university coming to the Valley? I hope everybody. And how many of y'all have heard that there's going to be a full-fledged medical school within the university? That's right. So this is an amazing opportunity before us, and we know that at HCISD, with what you guys are doing, we're going to feed perfectly, and serve as a pipeline for the new university and the new medical school. So this is going to be perfect. And what you guys make no mistake about it, the work you're putting in now and the preparation you're putting in now is going to come back, tenfold in terms of your return on investment. So just understand that you guys are in an opportunity and a position to take full advantage of this. And a lot of folks in the Valley probably will take many more years to figure it out, but you guys are right here at the epicenter of this sort of transformation and reorganization of higher education in the Valley. So really excited about this. But let me tell you and I'll talk a little bit about what I do sort of at the end. They did prepare some slides for me at the Regional Academic Health Center, and I want to go through them so you can kind of understand where we are now and what do we have now at the Regional Academic Health Center. And then I'll as we go, I'll touch into sort of a little bit where we are headed in terms of the new university and the new medical school. So right now, we have currently 3 different campuses, and the slides will kind of show the different campuses. So we have the Medical Education Division here in Harlingen. We have the Research Division in Edinburgh, and then a Clinical Research Division here in Harlingen that's right by the VA. And then also in Brownsville, there's a public health school as well. So that'll all be sort of changing very quickly here in the next few years. The dean currently is Dr. Lionel Vela. He's been a great leader I think it's going on 12, 13, 14 years now, since the sort of the early 2000s, since they got this off the ground and running. It was the first year it opened up was 2002. We already have, as a matter of fact, a new dean that's already been appointed, Francisco Fernandez. Frank Fernandez is coming from Tampa, Florida, and he'll be the new founding dean of the medical school. So he'll be reporting actually next month for duty, and so we're all anxious to help him be successful and get started as he puts this medical school together, all the residency programs it takes to create the medical school, and of course getting it accredited, etc. Right now, if you the slide sort of sums up what we do right now. This is actually a view from San Antonio, because right now the Regional Academic Health Center is under the auspices of the UT Health Science Center San Antonio. So until we can get accredited on our own and have our own accreditation and to be able to provide undergraduate medical degrees and of course residency training, etc. Until we can do that on our own down here, we have to do everything sort of under the approval or parentalship, if you will, or auspices of the Health Science Center in San Antonio. So that's kind of our parent, our mothership right now. So there's a ton of residency fellowship opportunities there. And in that medical school in San Antonio, there's 220 new students that matriculate every year. Some of them come down here and do their 3rd and 4th year rotations down here, approximately 24, but most of them stay in San Antonio. So in terms of when we started, I mentioned that was back in 2002. That's a picture of the first group of medical students that attended their 3rd and 4th year training down here from San Antonio. And they graduated in 2004. Actually, I can't point out which ones, you can't see it from this far, but actually 2 of them are actually, I apologize, 3 of them are practicing physicians in the Valley now. One's an ER doc, one's an OBGYN doc, and another one is a psychiatrist. And they are actually, so they finished their medical school, did their training, and they've been back here practicing now. Remember, that was back in 2002. So kind of cool that we're able to help train them, and then they stayed around to practice medicine. So as you know, you may or may not know, let me explain a little bit. When you go to medical school, you can't go straight from high school, right? You have to go to college first. You have to attend university. You have to do very well at a university and do very well on your MCAT score to even get into medical school. So once so putting in the work here in high school is very important, because your SAT test that you take, or the ACT, will be your first sort of gauge on how well you do on standardized tests, because you've got to knock it out of the park. When you do well on a SAT or ACT, then you can get into a nice competitive university, whether it's Rice or A&M or UT or Notre Dame or wherever you want to go, or even here at UT Rio Grande Valley. You will have all these opportunities before you if you have good enough grades and if you do well on these standardized tests. Well, the same thing is true for medical school. Your GPA is very important, but even more so is the score you have on your MCAT. It's called the Medical College Admissions Test. That allows you the ability to get accepted into medical school. And so when you do that, undergrad is 4 years, and then medical school is another 4 years. Now, just to let you know, they're looking at different models, and this is actually happening as we speak, to shorten that a little bit. So we're hoping to get that down to 7 or even 6 years, probably in the next 10 or 15 years. And so, matter of fact, that's already true in some locations where you can go to college somewhere for 3 years, and then you start medical school, and then after that first year of that medical school, they'll give you your bachelor's degree, and you kind of shave off 1 year of the process. So instead of it being 4 years of undergrad, of college, and then 4 years of medical school, it's 3 and 4. And so they're looking at different concepts right now, and so we'll sort of be eager to see what the leadership of the UT system and this new university and the new dean of the medical school, what they come forth with. But I suspect with what's going on across the nation, I suspect that we'll have some different opportunities to sort of shorten the time to get that medical doctorate degree. Remember, after you get your MD, so after I graduated from medical school in 1998, I couldn't do anything. It's just at that point, a worthless piece of paper, because you cannot practice medicine until you have a training in a specialty. So then I'm sure you all have heard of pediatricians. I'm sure many of y'all may still have a pediatrician that's taking care of you from time to time. Everybody's heard of the gynecologists, OBGYN doctors that deliver babies, surgeons that perform surgery, internal medicine doctors that take care of adults, family practice doctors that take care of sort of a broad range of patients. And that's just radiology, dermatology. There's a ton of specialties. And then to make things more complicated, some of the specialties like internal medicine or pediatrics or surgery have subspecialties, right? So I'm a subspecialist. I did internal medicine for 3 years. So after medical school, I did 3 years of internal medicine. So I was an adult doctor taking care of adult problems like diabetes and hypertension and thyroid disease and metabolic disorders, etc. Once you finish that, and you can practice as an adult medicine doctor, take care of everybody over the age of 18, but you also have the opportunity to specialize in a specialty. So I chose gastroenterology. So, and if you look at the word, it's gastro, enter, like enter a door, and then ology. So sometimes, there's Mrs. Vivian, sometimes even I have trouble pronouncing it. So you just remember the gastroenterology, and you can kind of enunciate it and you'll be fine. But if you say it fast, that's where you kind of fumble up. But we call it sometimes for short GI or GE. So sometimes we refer to ourselves as GI docs, but gastrointestinal or gastroenterologist. So that's another 3 years that I had to train just to specialize in gastroenterology. So cardiology is 3 or 4 years, endocrinology is 2 years, nephrology or kidney specialists are 2 years, things like that. And so you kind of see how it can kind of get complicated, but we cannot see patients or manage patients in that field until we finish that training. So we will have in the Valley, we already have internal medicine residency program. We have a family practice, 2 of them in the Valley, residency programs. Eventually, in short order, in the next 2 to 4 years, we'll have general surgery, psychiatry, growth of family medicine and internal medicine programs, and we'll also have pediatrics hopefully down the road as well. And so I think an OBGYN. So then those are the folks that after graduating medical school can stay here, do their training, and then basically practice medicine in whatever field they choose. So these are all the different kind of programs that are available right now in San Antonio, but again, that's at the Health Science Center. We are currently trying to create our own graduate medical education training programs here. So in terms of the students right now, we have a lot of students that have come from all over the place. Remember, the students right now start medical school in San Antonio, and they come down here and do their 3rd and 4th years down here. Remember, that will all be kind of going away when we have our own medical school here. They'll be able to start here and do all 4 years here, and that's going to be in just a few years. So what year will you graduate? Somebody help me here with the math. What year will you graduate? 17, okay. So by the time you all will already be able to start, if you choose to go to university here in the Valley, you'll be able to start here with UT Rio Grande Valley, and then of course, whether it's 3 or 4 years, depending on if they come up with some novel concepts to sort of fast track the track towards a medical doctorate degree. You'll either have to spend 3 or 4 years, in the university setting, preparing for matriculation in medical school, taking all your pre-medical prerequisites, taking your MCAT test, and then applying for entrance into medical school. So you all will be in a position to take full advantage of the university here in the Valley and the medical school here in the Valley. That's an amazing, amazing opportunity. In terms of becoming a physician, let me tell you that most folks don't have some misconceptions. They think that you have to be, it's all science and all STEM type of deal. But let me tell you that sort of everything's important. Being sort of well-rounded is important. Reading is very important. Being a good communicator is very important. How many people have gone to a doctor and they feel like they can't really communicate well with the doctor and that kind of stuff? And so there are a lot of folks that sort of went into medicine and they didn't realize that communicating is very, very important. So it's not all just science. That's important, but I think that the communication and sort of being a well-rounded person is going to allow you to really make that connection with the patients, and then when you do that, you'll be able to get glean more important information from them, and you'll be able to make a more accurate diagnosis, be able to help treat them, gain their trust, and things like that. And so I think that's very, very important. So, anybody can become a doctor. A lot of misconceptions about this and that. Right now, I think the girls are actually beating the guys in a lot of medical schools now, because there's more and more females that are pursuing a career in medicine, which is great. So, really it takes just a work ethic. Like I said, you have to prepare well starting in high school to get to a good university, prepare well on your SAT, that's a practice for your MCAT, because the MCAT is going to get you a ticket to attend medical school. The GPA is also very important, but it's that MCAT test, that's the absolute most important thing. Yeah, the next slide talks about money. It says, do you have to have a lot of money to attain medical to attend medical school? And I think that's another big myth, because so basically, just like anything else, the university, attending a higher ed institution, it can be expensive sometimes, but like anything else, there's scholarships, there's loans, and things like that. And I think you have to just start with trying to figure out where your passion is, what do you want to do, and the rest will fall into place. But don't think that you have to have all this ton of money, to attend medical school. I'm still paying college and medical school debt back, but I don't even think twice about it. It's just it's just sort of what we all do, I don't have any regrets. And there are some people, though, that I will tell you that go to these sort of real expensive private schools because they want that, and I have heard some people having second guesses and regrets about that, because their education was like 3 times what it would have been if they had just gone to medical school in Texas, because they were a resident of Texas and you could pay the resident price, the cost of tuition, as opposed to going to Cornell and paying like this huge, and I'm not picking on Cornell, but just to make an example. And sometimes I've heard of some folks saying, boy, I wish I would have just stayed, and gone to medical school in Houston or San Antonio, or hopefully here the Valley, in UT Rio Grande Valley. And so, those kinds of things maybe are important, but don't let it discourage you from pursuing a career in medicine because you think it's going to be too expensive. Really, just follow your passion. I think my slides are down here, but anyway. And that's pretty much obvious. You can anybody can attend medical school. So in terms of the school is very important. We talked about this. I mean, one of the things that when I talk to students, at your age, is getting them to realize that the study habits and the work ethic that you put in now are going to pay big dividends when you attend university. You'll already have the study habits that you need to do well in college. You'll have to step it up a couple notches. We all did, but I think starting yourself right now, being diligent about your schoolwork, having that discipline, making the right decisions, is going to pay off big time for you down the road. All right, I'm going to skip some of these slides and get to something more exciting here. I kind of want to show you what I do and talk about sort of how I think I already talked about that. College is 4 years, medical school 4 years, residency can be anywhere from 3 to 6 years. Don't let that scare you. It flies by. It's a lot of fun. Oh, and by the way, there's over 150 medical schools throughout the country. And of course, starting very soon, we'll have one here in the Valley. So I'm talking about physicians or being a medical doctor, but just so you understand, and the slide shows you there are a lot of other career paths and tracks in the healthcare field. There's a lot of allied health professional careers, physical therapy, occupational therapy, physician assistants, etc. Respiratory therapists. Of course, there's the doctors for the teeth, or the dentist, researchers, veterinarians, pharmacists, and then of course the folks that choose the business or administrative side, hospital administrators and things like that. There's a ton of job opportunities in the healthcare sector if that interests you, but you just have to figure out find your passion and what sort of gets you excited. And that really is the key, because for me, like, I love what I do, and sometimes I feel like it's not work. It's fun. Now, last night I was on call and I didn't get to bed till about 1:30. It did feel like work, unfortunately, but there are some bad days. But then when I got up this morning, I got excited because I said, I'm going to go talk to Cano students today. And then I got excited, so you guys brought a smile to my face. After I leave here, I'll probably get a headache again, but anyway. We'll get over that. That's the price you pay for sometimes for picking a career like this. But one of the things I want to tell you, and a lot of folks see how hard physicians work, and they say, "Oh, forget that. I don't want to work that many hours." Now, I choose this. I could easily make my life easier by joining a group and things like that. But I love being my own boss and doing my own thing. I know a lot of women and a lot of guys in both sexes that actually choose a different type of practice, a group situation, so they have a better lifestyle. So it's not a big deal. It's not a huge problem. A lot of folks choose larger groups so they can only be on call 2 days a month, or not on call at all, or don't have to go to the hospital, just have a clinic. And so there's a lot of different varieties out there for whatever sort of lifestyle that you want. But it really starts by just pursuing sort of that field, that career that sort of really suits your interest and really kind of goes along with what you sort of call your passion, or what gets you excited. And then once you do that, then the rest of it's just kind of fun, And so one of the things I want to tell you is how lucky you guys are, because I want to tell you a little bit about my story. When I was in high school, I did not know what I wanted to do. So I was a junior in high school, and all I knew was that I was going to UT. Don't ask me how I knew that, but it had something to do with watching baseball when I was a kid, and getting excited about the Longhorns and thinking someday maybe I'll play baseball for long. Of course, that never panned out. But long story short, I kind of knew I'm going to UT. So that was a foregone conclusion. The problem is, and I was a good student in high school. The problem is that I had no idea what I was going to do when I got there. So I'm just going to go to UT. So, and in many ways, this is why I tell you, you guys are way ahead of me. So middle of my junior year in high school, my chemistry teacher comes up to me, Donato Garcia, great guy, comes up to me, says, "Nolan," he says, "so what are you going to do when you go to UT? Have you decided yet?" And I said, no, I really don't know. I said, I'll just take general classes and it'll come to me. And he says, "Nolan, that's not a very good plan." He's like, this is expensive, and he's like, "I think you ought to put a little more thought into it." I said, "Well, maybe you're right." I said, "Well, I don't know. I'll think about it." So, I got thinking of this kind of stuff. 2 weeks later, still didn't have a clue. So I came to class, and Dr. Garcia says, "Nolan, can I talk to you for a second?" It was after class. I said, "Yeah." So I thought I was in trouble. What did I do wrong or something? But of course, I didn't do anything wrong. He says, "Nolan," he says, "man, it came to me the other day, and I thought about it. It's the first time I saw you." He said, "I wanted to tell you that I figured out what you're going to do." I said, "Really?" So, wow. Okay, well, please tell me, right? And so he says, "You're going to be a physician." And at that point in my life, I hadn't heard physician very many times. I kind of figured, I was like, that's a doctor, right? He goes, "Yeah, a medical doctor." He's like, "That's what you're going to do." I said, "Okay." And it was kind of an awkward moment. I said, "Okay." So, well, wouldn't you know that I went home thinking about it, and I was kind of obsessed about it, thinking about it, and then I kept thinking, like, all the time. Did you remember, like, all the times you've been to a doctor, thinking about it, like, "Yeah, that's kind of cool," and and that seems pretty cool. And so within a week, I owned that decision. I owned that it's sort of like, it just like, so from then on, what are you going to do? Well, I'm going to be a doctor. And so that's basically my story. If it wasn't for that one person who came up to me and took an interest, to mentor me and to help me out and say, and to really be that catalyst to help me make that decision, or actually make that decision for me, I wouldn't be here, today. So, in many respects, you guys are well ahead of me, because I was a junior till I even thought about it. So I think that for those of you all who really want to choose a path in the health careers, especially in medicine, you guys keep doing what you're doing. One of the things I want to tell you is, I mentioned this before, you don't have to be this math science genius. It helps to do good in those fields, but I think so many other things are important as well. And I'll tell you that a lot of the medical school admissions committees, they like it when they get some English, non-traditional majors, English or political science or whatever, because these are actually normal, well-rounded people, and sometimes they get tired of just seeing the sort of the science people that are just kind of too left-brained, if you will, and that kind of stuff. So it really is important to be a good reader, to be a good communicator, and to be well-rounded. So don't think that you just have to be all about science. What I do every day is really managing people, and so I think it's very important. And you have to obviously care for folks and want to help folks and be a good empathic person. So this is what I do. You can't really see from that far, but in a nutshell, as a gastroenterologist, my expertise is the digestive system. So from the mouth all the way through to the end of the colon, and of course the liver and the pancreas. And so I deal with that. I want to kind of show you a couple of little pictures. So this is I was going to have one of the techs from the hospital bring an instrument over here, but I didn't want to scare anybody. So this is sort of what I see when I go in the esophagus. So I do a lot of endoscopies, and one of the things that makes my job kind of cool is in the morning I get to use my hands and my and do procedures. And so half the morning I'm there, doing procedures, colonoscopies and endoscopies. Today I did 2 ERCPs where I took stones out of the bile duct. One was a 91-year-old lady who still cooks for all her family members. It was amazing, right? She's 91, very functional lady. She just wants to go home so she can go back and all her family was like, there were 11 there. Like I think there were like 11 starving people, like they hadn't eaten or something. They're like, can you please get Gammy back home so we can? So anyway, I took out a stone from her bile duct, and she's doing great, by the way. So I do a lot of endoscopies. It's really cool. And then in the afternoon, I'm in my office talking to patients, diagnosing patients, figuring out how to make them better. And then, sometimes I have to schedule them to have an endoscopy at a later time, et cetera. So what are you looking at here? Well, on the left, on the upper left, that's an example. With the lights on, you don't really see too well, but there's some red streaks. That's from esophagitis. That's from sort of eating a horrible diet and sometimes being too heavy, like me, and then you get heartburn and stuff like that. And over time, that poor diet and that and reflux of acid into the esophagus can cause can cause ulcers and erosions, and that's caused esophagitis. That's what you're looking at there in the top left. In the middle, if you keep getting reflux and acid reflux in the esophagus, it can actually start to close off, and that's called a stricture. And that's what you see, that little ring and narrowing, and that's a stricture. And then on the right side, that's somebody who has a lot of forceful retching and vomiting, and it usually happens right above a hiatal hernia, and they get a tear in the esophagus called a Mallory-Weiss tear, and that's sort of after I put a lot of clips to close that defect, that tear up. So that's kind of cool stuff. The next slide is on the lower end. This is called a colonoscopy, and in folks over 50, we do these colonoscopies every 10 years to prevent colon cancers, and so by finding and removing polyps. Those are all examples of polyps. You can see these little things that look like almost like a cauliflower on a stalk, these little growths that happen in the colon, and if we don't remove those things, they can turn into colon cancer. Does anybody here know anybody that's ever had colon cancer? See, it's 8% lifetime risk, and so it's the second most biggest cancer killer in the United States, and it's actually March is Colon Cancer Awareness Month. But anyway, just had to throw a plug in there for that. So the nice thing about my job also is, as a physician, I get to help people, and I love doing that every day, just diagnosing my patients and treating them and getting them better, and also preventing cancer. But one of the other nice things is for me that's really gratifying is getting involved in the community. So I love to mentor students. It's probably not a month that goes by that I don't have some high school student come in on a Saturday with me to do procedures, or or during the week sometimes, but schedules are busy. So usually when I'm on call, almost all the time I'm on call, I have a student come in and watch me do procedures or something like that. And so that's Trey Moreland. He's a senior at South, and he's my protege right now. And on the left, that was actually when they swore me in the last time at the school board. And so as a trustee for the school district, I get to also get involved in other ways as well. So it's been very gratifying, and I think all of these things have come to, opportunities have come before me. because, I'm a physician and leader in the community, and I think you all will definitely, I think, enjoy that aspect of being a physician. Your phone goes off a lot to help with this or to help with that or be involved with this committee or that thing, and I think it's a great profession that also opens the door for you all to get involved in many other ways. Very, very gratifying. Well, with that, I'm sorry I talked so long, but I want to take your questions. If anybody have any questions, whether it's about becoming a doctor or a gastroenterologist or anything. Yes, sir.
How much do you get paid a year?
Dr. Cavazos, did you plant that question, sir? So, I always get asked, I don't know what it is, there's always a fascination with money and let's just put it to you this way. I'm very blessed, and money's not an issue. But there's too much. That question is pretty much a loaded question because there's too much variation in sort of what doctors get paid from specialty to specialty. So maybe the question you should ask is, in the United States, what is the average salary of a gastroenterologist? Would you like to ask that question? All right. So it's around $450,000 in the United States, right? Más o menos. Any other questions? Yes, ma'am.
I noticed that your science realm health science realm is pretty big, but is there more to that besides health science? I prefer to be a marine biologist, that's why.
Right. So, I mean, I think in that probably a different career track. I mean, I think you have to. I think one of the things is biology. There's a lot of different fields, and marine biology is one of them. And there's certainly a lot of master's degrees, and even doctoral programs as well. Opportunities to become a researcher, opportunities to work for the state and the federal level, especially with that field, and especially down here, a lot of opportunities for marine biology. So I think that that's a growing field. That's a great field. I'm not as familiar with that field, but I can tell you that there are opportunities down here, and I absolutely think there's a job market for that as well. But one of the things you can do is talk to your counselor, also get connected with a college counselor, and I would also research this online because there are, specifically for that field, there are some universities that are great for that, and other universities that won't help you at all. So when you have that sort of refined of an interest where you kind of know what you want to do, then you can start picking university choices based on where their strengths are. And so, if you wanted to do an engineer, you would kind of pick, certain universities. But if you wanted to do liberal arts or something, you may want to choose totally another university. And so that's where you kind of have to start doing your homework and researching. I think you'll find that there are several great universities that would be good for that. Any other questions? Yes, sir.
Like this serious question, how did you still have like fun in college and like going to medical school? Because it seems like a lot of work. You stayed like 11 to 14 years after high school. That's like just prime.
Yeah. I think that's a great question because I saw my friends that were already kind of working. They had jobs, and so they already had a car and they had a little money, and I was still a student, and I was bummed out and things like that. So I think that's a great question. You basically are around 200 other people who are going through the same thing, and you find ways to have fun. And I had a blast. Did I have all the money in the world? No, absolutely not. But it was something that now I can look back and say, man, I'm glad I did that. And there is a lot of what we call delayed gratification, no doubt. If you're going to make a career choice that's going to involve 14 years after high school, I mean, there's a lot of delayed gratification involved there. There's a lot of looking towards sort of that sort of light at the end of the tunnel. You know what I mean? But it's very important that you do that, and it's well worth it that you do that, because if you don't, you're going to have regrets. You have a choice right now to do anything you want to do, as long as you make the decision, own it, work hard, make good decisions, and just keep working towards it every day. Because at the end of this, if 14 years from now you didn't do that, you're going to look back and say, man, I wish I would have listened to Dr. Perez and really, done that, because there's going to be some of you, guaranteed, there's going to be some probably 5 or 10 in this audience that will be physicians, that will be neurosurgeon or a plastic surgeon or a pediatrician or whatever. And the rest of you will be thinking like, man, how come I was in the same auditorium? I had the same idea, I had the same thought, but it's really being committed to your decision, sticking to it, making good decisions, and working hard. Any other questions? Yes, ma'am. Go ahead. What courses do you take in medical school? Well, I mean, it's a standardized curriculum. It varies from medical school to medical school, but it's a pretty standardized curriculum. Some of them, there's a little bit of overlap with undergraduate, but it's much more clinical, pharmacology and biochemistry, organic chemistry, of course, a lot of anatomy and especially physiology, and then pathology. So there's a ton of that sort of science behind what we do as doctors. And then you get into 3rd and 4th year where it's a lot of clinical stuff where we're just seeing patients, talking to patients, interviewing them, doing physical examinations, interpreting labs and imaging results, and then sort of putting all that together, that information together and making an accurate diagnosis. And then instituting the therapy to correct the problem, right? So one part is sort of putting it all together and making a diagnosis. Then the other part of it is, well, what do you do to help the patient? And then, of course, even more importantly, how could we have prevented this? And is there a way that we can talk to more patients about preventing this kind of situation? Because what we're trying to do with healthcare is kind of move from a sickness model of healthcare that we have right now into more of a preventive or wellness model, right? So wouldn't that be nice? That's kind of what there's a little bit changing into the medical education curriculum right now to sort of address that as well. Yes. Yeah.
Have you ever doubted your choice to become a physician?
That's a great question. Typically when that happens, it's kind of like his question before. Sometimes during that long road, you always doubt yourself. That's normal. And what I did during those times when I'm just frustrated and I'm thinking like, my God, I still have how many more years? And you're thinking, and that kind of stuff. And really, you kind of just, take it and sort of, in chomps and just sort of chop it up into little sort of goals. And so for me, it was always just, what's my next goal? And for me, like the big next step was, okay, getting that MD, wow, then I can say I'm a doctor. Of course, I can't do anything until I get trained in something, right? But at least I can say I'm a doctor, right? So it was always like, what's that? Because that's only like 2 years away. And yeah, there was still time to get a little frustrated or to doubt yourself. And that's the time when I'd call home, talk to my parents. I was blessed to have 1 or 2 mentors, doctors that I met that I can call up and they'll say, hey, come over for breakfast tomorrow or lunch or whatever, and they would kind of reach back and talk to me, and then seeing them and how happy they were and what they were doing served to really further motivate me. And then next Monday I was all right, I'm good. I got that sort of that charge up, or I got that sort of I guess motivation again to kind of keep going. And so you just have to use different techniques. But it's normal. Everybody has doubts, and everybody kind of thinks like, oh my God, is this not for me? But it was kind of interesting. Probably not until a few months before I crossed the stage and got my doctorate, got my MD, did I really believe, man, I'm actually going to be a doctor, because it just doesn't really, it's almost like a surreal experience. And then suddenly you're a doctor, and then you're like, okay, that's awesome. And then you have the next step, to do your training and stuff like that. So, but that's normal. You just have to, pick up the phone, call folks, reach out, have a mentor or 2 or 3, and then, put them to work, And then you're going to do the same thing, right? When you're, a neurosurgeon, and then you're going to reach back and help other kids to sort of get to your level. So, yes. Go ahead.
After medical school and your residency, what did you do after that? After your residency?
So for me, I was actually, my story is a little bit more complicated. I didn't mention it before. After medical school, I was actually a Navy doctor. So I served in the Navy as a physician, as a general medical officer for 4 years. That's another option available to you if you guys are interested in serving your country. I did that. So I was a general medical officer for 4 years. Then I came back and finished my internal medicine residency here at the RAC. I mentioned that it started in 2002. I was among the first group of internal medicine residents to do the training here. So I did 2 years of internal medicine training here. I had already had 1 in the Navy, and then I went off to Michigan to do my fellowship in gastroenterology, and that was a 3-year fellowship in gastroenterology. And then I came back in 2007, and that's I've been in practice here since 2007. That's almost 7 years ago. So. And one thing I want to say is, as a physician, somebody who has a practice, I have a physician assistant that works with me. I have a very busy practice. I'm also a business person, or I'm a businessman, right? I mean, I employ 12 people, and including a physician assistant, and including myself, the company that I own. I'm an employee of the company, and my wife runs the practice as the administrator. That's an awesome responsibility as well. And I enjoy that part of it as well. A lot of doctors don't. I do. I mean, I enjoy both aspects of being a physician, but also being a strong leader at the office to run that business and to run that practice. Instilling that culture at the office of customer service, of being empathic when they answer the phones, when they talk to the patients. So if you go to my office, you get that feeling from every person that they care about you. Because that's what we created. I mean, I put a lot of blood, sweat, and tears into that practice, and we still do. We meet with our staff, on a weekly basis, and so that's another aspect about what I do is, yes, I treat patients and diagnose patients, help patients, but I'm also a businessman, and I also, get involved in other ways. So it's kind of, for me, it's kind of a multifaceted job, and it's allowed me to get involved in so many different things in the community. And so I'm having a blast. It's a lot of fun. Any other questions? How much more time do we have? One more question. Yes, sir.
Okay, in your opinion, what are the best attributes or qualities that a person can have to be successful in medical field?
Well, I mean, I think it's a great question, and that's a kind of a loaded question, because you kind of need so many different sort of attributes. I would probably say, the most important thing for me, the most important thing is basically, your passion and your work ethic. I mean, because, it's a lot of, long hours studying, long hours seeing patients, being on call, sometimes in the middle of the night, the sleepless nights, things like that. And so you really have to have that passion for, hey, I want to do this. This is for me. And plus that work ethic to really do it, do the highest quality job you can do, right? I mean, so if you don't have, that work ethic, that's when a lot of folks kind of say, this is not for me. Maybe I should choose something a little bit easier, And so, but it's a lot of fun. And I want to tell you that you don't have to be a genius or, you have to be the smartest guy. It's really about the work you put into it, The grades you get, when they're A's and, hundreds or whatever, all these awesome grades you get, I'm sorry, but it's not because you're real smart. It's because you studied and you work hard. You know what I mean? That's how you get intelligence. I mean, it's work ethic. It's about the work you put into it. What you put into it is what you're going to get back, right? And so really that's kind of what you have to all realize, that anybody can do this. Any one of y'all could be right here standing where I am. Not a special gift or something that I was born with. It's something that I decided to do. I stuck with it, and I worked hard. Thank you all so much for allowing me to be here.